Okay, let's unpack this. Picture this scenario. You're out with your dog, maybe just on your usual walk, or perhaps you're checking on your cat's litter box habits, and you see something a bit off.
Yeah, something that makes you stop.
Exactly. Maybe it's a little whimper, or they seem to be straining more than usual, or maybe you even see, well, a spot of bright red blood.
Mm.
It's the kind of thing that, sends a little jolt of worry through any pet owner, right?
Oh, absolutely. It can be really alarming.
So today we're doing a deep dive into two terms that might come up in this situation, maybe even directly from your vet.
Yeah.
Dyschezia and Hematochezia.
Exactly. And noticing those signs, yeah, it's definitely concerning. So our aim here is really to cut through any confusion. We want to give you a clear understanding of what these terms actually mean for your pet,
Okay.
what could be going on, underneath it all, and what the most important takeaways are. Think of this as your fast track to getting informed, feeling a bit more in control.
Right. And we've got some really solid information here pulled from a veterinary reference text. It covers the basics, what these conditions are, potential causes, how a vet might sort of piece things together.
The diagnostic puzzle.
Yeah, exactly. And the different treatment options for both dogs and cats. Our mission is really to distill this, get to the core information, and understand the potential implications for, your furry family member.
Let's do it.
So let's start right there, defining our terms. What exactly are Dyschezia and Hematochezia?
Okay, so dyschezia. In simple terms, it just means painful or difficult defecation. The key word there is difficult. It's about the discomfort or the extra effort your pet seems to be putting in when trying to go.
Okay, difficult defecation. Got it. And Hematochezia.
Hematochezia, on the other hand, that specifically refers to seeing bright red blood in or on the feces. And that bright red part, it's actually a really important clue.
Why is that?
Because it usually tells us the blood is coming from the lower part of the digestive tract. So think colon, rectum, or anus. Fresh blood hasn't had time to get digested and turn dark.
Ah, okay. So we're not talking about just like a bit of constipation or a slightly off stool.
Yeah.
This is noticeable pain or actual fresh red blood.
Precisely.
Now, what's actually happening inside their bodies? What's the mechanism that leads to these signs?
Well, what's interesting is that both dyschezia and hematochezia often point towards inflammatory conditions, sometimes infectious ones, or even what we call neoplastic conditions.
Neoplastic, meaning cancer-related.
Yes, potentially cancerous growths. Basically, something is causing irritation or disrupting the normal, smooth function of that lower GI system, the colon, rectum, or the anus.
And does this tend to hit certain pets harder? Like, are dogs more prone than cats, or is it specific breeds?
Not really. The sources suggest both dogs and cats can experience these issues. And interestingly, there doesn't seem to be a particular breed or even sex within dogs or cats that's significantly more likely to get it.
Huh. It's a pretty widespread then.
It seems to be a concern that can pop up across the board, unfortunately.
Okay, so thinking as a pet owner, what are some specific things I might actually see my pet doing? What behaviors are red flags for Dyschezia or Hematochezia?
Right, so things you might notice at home, you might actually hear your pet vocalizing, whimpering, maybe even yelping while they're trying to go.
Oof, okay.
Another really key sign is something called tenesmus. That's that persistent straining. They keep trying and trying, often repeatedly, but don't produce much stool, or maybe none at all.
Like they really feel the urge but just can't.
Exactly. They feel the urge, but it's not happening effectively. And because it's painful, they might start going less often. They might even seem to avoid trying to go altogether.
Which I guess could lead to other problems.
Yeah, absolutely. That avoidance can then lead to constipation, or even a more severe form called obstipation, where they become really, really blocked up.
That sounds incredibly uncomfortable.
Mm.
Besides seeing the blood itself, are there other changes in the actual poop I should watch for?
Yes, definitely. If the underlying issue is more related to colitis, that's inflammation of the colon,
Colitis, okay.
you might see stool that looks mucoid or slimy and is also bloody. Often with colitis, what's characteristic is they need to go more frequently, but the actual amount they pass each time might be quite small.
Increased frequency, small volume, mucus, blood. Got it.
And also keep an eye out for scooting, when they drag their rear end on the ground.
Oh yeah, the scooting. Isn't that usually worms or anal glands?
It can be, but it can also absolutely be linked to anal gland problems that are contributing to the discomfort and difficulty of dyschezia. So it's another clue.
Okay, so those are things I might spot at home. Now, if I bring my pet in, worried about these signs, what's the vet looking for during the physical exam? What might they find?
Well, a really thorough physical exam is critical, and that absolutely has to include a rectal examination. That part is paramount.
Right, understandable.
During the exam, the vet might actually feel hard feces, which points towards that constipation or obstipation we mentioned.
Oh.
Or, conversely, they might detect diarrhea, suggesting inflammation or other issues lower down. They'll also be carefully feeling for any abnormal masses, any growths in the colon or rectum,
Mm-hmm.
any unusual thickening in that anorectal area, or any narrowing. Those are called strictures within the rectum or colon. And they'll definitely palpate the anal sacs, check if they're enlarged, painful.
Yeah.
Like we said, those can be a big source of trouble.
Are there other physical things they might pick up on?
Yeah, a few other possibilities. In male dogs, an enlarged prostatomegaly is the term,
Prostanomegaly?
that can sometimes press on the rectum and make defecation difficult.
Mm-hmm.
Similarly, something called a perineal hernia, which is a weakness in the muscles around the anus, that can also interfere.
Okay.
If there are perianal fistulae, those are inflammatory tracts around the anus. The vet might feel those. And finally, they'll check for just, physical blockages right at the exit, like matted hair and feces. That's called pseudocoprostasis.
Pseudocoprostasis. Quite the mouthful.
It is. Just means false constipation due to blockage.
Okay, so we've defined the terms, talked about the signs we see at home, and what the vet finds. Let's get into the why. What's actually causing these issues? The source material seems to group the causes.
That's right. It helps to think about them in sort of three main buckets. First, issues directly affecting the rectum and the anus itself. Second, problems starting within the colon. And third, a category called extraintestinal diseases.
Extraintestinal,
Yeah,
meaning outside the gut.
exactly. Conditions elsewhere in the body that end up affecting defecation.
Okay, let's start with the rectum and anus then. What kind of problems crop up right there?
So right in that area, you could have those strictures, the narrowings we mentioned, or even muscle spasms.
Yep.
Anal sacculitis, inflamed anal sacs, or actual anal sac abscesses are pretty common culprits.
Right, the scooting connection again.
Yep. Perianal fistulae, too. Sometimes, believe it or not, a foreign object gets lodged back there, causing a lot of pain. That pseudocoprostasis, the matted hair blockage. Other things include rectal prolapse, where part of the rectum actually sticks out. Trauma, like bite wounds near the anus. Various types of neoplasia, think adenocarcinoma, lymphoma, anal sac tumors, even rectal polyps. And less commonly, a skin condition called mucocutaneous lupus erythematosus can affect that area.
Wow, okay. That's a lot just for the rectal and anal area.
Yeah.
What about problems originating in the colon itself?
In the colon, again, neoplasia is a concern, adenocarcinoma, lymphoma again. In cats specifically, there's a condition called idiopathic megacolon.
Idiopathic meaning we don't know the cause.
Exactly. The colon gets really enlarged and loses its muscle tone, leading to severe constipation and difficulty going. Then there's inflammation, could be inflammatory bowel disease or IBD,
Read that.
or infections from parasites, or even colitis that happens because of a food sensitivity, what's called dietary responsive enteropathy. And of course, just straightforward constipation can start in the colon and cause difficulty.
Okay. And that third bucket, the extraintestinal diseases, problems outside the direct digestive tract.
Right. These are things elsewhere that impact the ability to poop comfortably. A fractured pelvis, for instance, or even a broken leg in the back. It just hurts too much to posture correctly.
Makes sense.
Prostatic disease in male dogs, like we mentioned, pressing on the rectum. Perineal hernias. Even tumors located within the pelvic cavity, but not directly in the colon or rectum, can sometimes cause issues like Dyschezia or Hematochezia.
So thinking about all these potential causes, are there things that might make a pet more likely to run into these problems? Any specific risk factors?
Yeah, the source points out a couple things. One is definitely ingesting stuff they shouldn't, indigestible things like too much hair from grooming, bone fragments, random foreign objects. These can easily lead to constipation.
Which then leads to straining and pain.
Exactly. The other factor mentioned is more about environment and management, things like maybe not cleaning the litter box often enough for cats, or maybe dogs don't get enough chances to go outside.
So they hold it too long.
Right. Holding it too long can contribute to constipation, and then you're back to the risk of difficult defecation. It's a good reminder that those, day-to-day care things really do matter.
Absolutely. This all sounds quite complex to sort out. How does a vet actually figure out which of these many possibilities is the culprit for a specific animal? What's the diagnostic journey look like?
Well, the diagnostic process really starts, as the source emphasizes, by recognizing that hematochezia, the blood, could be from something widespread, like colitis affecting the whole colon.
Right.
Or it could be from something very localized, like a single tumor in the colon or rectum. Differentiating those really relies heavily on the detailed history you provide as the owner.
Okay, the details matter.
They matter hugely. That history, combined with a thorough physical exam, and again, we have to stress that includes a careful rectal exam, it's non-negotiable, really.
So what are some of those key history details or exam findings that help point the vet one way or another? Like, how do they tell colitis from a tumor, for example?
So, one clue is how it presents. For instance, dogs with colorectal tumors often show that blood, the hematochezia, but maybe without a big change in how often they go or the consistency of the stool, at least initially.
Hmm.
Although in more advanced cases, if the tumor is blocking the way, you might see those really thin, pencil-like or ribbon-like stools.
Oh,
That contrasts with colitis, where you typically see that increased urgency, small amounts passed frequently, maybe with mucus. So the pattern is different. And again, that rectal exam feeling for a mass versus feeling generalized thickening or nothing specific is critical.
makes total sense.
Yeah.
What about other medical problems that could maybe look like this? How are those ruled out?
Yeah, good question. Thinking about differential diagnoses is important. For example, difficulty urinating, which we call dysuria or stranguria, or blood in the urine, hematuria.
Could look similar from a distance?
It could potentially be mistaken for defecation trouble, but usually a urinalysis helps sort that out. If it's a urinary issue, you might find pus or crystals or bacteria in the urine sample. So again, the history you give, are they straining to pee or poop? Combined with the exam and tests, like urinalysis usually clarifies things. In female animals, you might briefly consider dystocia, which is difficult birth, but the whole clinical picture would likely be very different.
Right. So beyond the history and the physical, what other tests might be needed to really nail down the cause?
Yeah, lab work is often a big piece. A complete blood count, or CBC, a biochemistry profile, and a urinalysis are pretty standard.
What do those tell you?
Well, sometimes they might be surprisingly normal, but other times they can show subtle hints. Maybe signs of chronic blood loss, like a certain type of anemia, or they could show signs of infection or inflammation happening somewhere in the body. And a fecal flotation test is standard too, just to check for intestinal parasites that could cause colitis.
Makes sense. What about looking inside? Do x-rays or ultrasounds come into play?
Imaging can be really useful. Pelvic x-rays, for example, might show disease within the pelvis itself, maybe a foreign object causing a blockage, or even a fracture that's causing pain. Abdominal ultrasound can be good for looking at things like the prostate gland or maybe masses higher up in the abdomen, although the bones of the pelvis can sometimes make it hard to get a perfect view of the very end of the colon and rectum.
Right, the bones get in the way.
Exactly. So for a really direct look at the lining of the colon and rectum, procedures like colonoscopy or proctoscopy are often invaluable.
That's with the camera.
Yeah, a small camera on a flexible tube is gently inserted. It lets the vet see the lining directly, evaluate for inflammation or growths, and importantly, take biopsies. Those small tissue samples can give a definitive diagnosis.
Okay, so you get the diagnosis. What happens next? Treatment options. I imagine it really depends heavily on what you found.
Absolutely. Treatment is completely tailored to the specific cause. For instance, if it's a colonic stricture caused by a tumor, treatment might involve surgery to remove that narrowed section, or maybe trying to stretch it open with a special balloon catheter.
Balloon dilation, okay.
And if there's a stricture or a mass that's just making it hard to pass stool, even if you can't remove it right away, the vet might prescribe laxatives like lactulose just to soften things up and make defecation less painful.
That makes sense, providing some relief. What about if you can remove a growth or a mass?
Yeah, generally if there's a colorectal mass, surgical removal is the preferred approach if it's feasible. For some benign growths, like polyps, sometimes they can actually be removed less invasively during that colonoscopy procedure using a little wire snare and cautery.
Ah, interesting. Endoscopic removal.
Mm.
And what about medications? Are there specific drugs that are common in treating these conditions?
Oh, yes, definitely. Medications play a big role depending on the diagnosis. If there's a bacterial infection, like an anal sac abscess, antibiotics like amoxicillin combined with clavulanic acid are often used.
Okay. Standard antibiotics.
For managing colitis, those anti-inflammatory drugs are key. Maybe sulfasalazine or prednisone for dogs, often prednisolone for cats. These help calm down the inflammation in the colon. For dogs with those perianal fistulae, a drug called cyclosporine is often a really important part of the treatment. And for constipation, like we touched on, various laxatives, lactulose is common, docusate sodium or calcium or others might be recommended at specific doses for dogs or cats.
Okay.
And one more for cats, if they have that moderate to severe megacolon condition without a physical blockage, a drug called cisapride might be used. It helps stimulate the colon muscles to work better, usually along with laxatives and diet changes.
Are there any treatments or maybe supplements that should generally be avoided?
Yes, the source highlights one important caution. Generally, you want to avoid things that significantly bulk up the stool, especially supplements with lots of insoluble fiber.
Why is that? Seems counterintuitive for constipation sometimes.
Well, unless your vet specifically recommends it for colitis, the concern is that if there's an underlying narrowing or partial blockage, adding more bulk could actually make the blockage worse and increase discomfort. So caution is advised there.
Got it. So once treatment starts, what's the follow-up plan usually look like? How is progress monitored?
Follow-up really varies based on the diagnosis and the treatment used. For example, animals getting those balloon dilations for strictures often need multiple sessions.
Makes sense.
After surgery to remove a mass, there's usually a recheck appointment around the time stitches would come out. If it's colitis managed with diet changes, you'd typically expect to see improvement within, say, 5 to 7 days.
Okay, relatively quickly then for diet changes.
Often, yes. But regardless of the specific situation, you, the owner, play a huge role in just daily observation and keeping in touch with your vet, especially early on in treatment.
Constant communication is key.
Definitely.
And are there potential complications pet owners should be aware of? Things that could go wrong?
Yes, unfortunately, there are a few possibilities. Sometimes, after surgery involving the anal sacs, or if a colorectal tumor affected the sphincter muscles, fecal incontinence, the inability to control bowel movements, can occur.
Oh dear. Okay.
It's a potential risk. Also, if that severe obstipation isn't managed effectively and goes on too long, it can unfortunately lead to secondary megacolon, where the colon permanently stretches out and loses function, which is then a more challenging long-term issue.
Okay, good to be aware of those possibilities. Right, let's try and pull this all together for everyone listening.
Yeah.
What are the absolute must-know points about Dyschezia and Hematochezia in our pets? The bottom line.
Okay. The key things to remember are Dyschezia, painful or difficult pooping, and Hematochezia, bright red blood in the stool. These are significant signs. They always warrant a trip to the vet.
Don't ignore them.
Don't ignore them. They can stem from a whole range of causes, some relatively minor, others much more serious, including potentially cancer. Getting the right diagnosis usually involves a thorough physical exam, and that almost always needs to include a rectal exam.
Crucial step.
Crucial. And then the treatment plan that works best is going to be totally specific to whatever underlying cause is identified.
Right, so for anyone listening who might have seen these signs, just understanding the terms, the possibilities, really helps them have a better conversation with their vet, doesn't it? Be a better advocate.
Absolutely. It empowers you. And maybe here's a final thought to take away from this. Really become a detailed observer of your pet's elimination habits.
Get to know their normal.
Exactly. Pay close attention to any changes, frequency, consistency, any sign of straining or discomfort, and definitely any sign of blood. These details you notice can be incredibly valuable clues for your vet. They can lead to earlier diagnosis, faster treatment.
So being proactive, observant.
Proactive observation plus timely vet care, that's really fundamental for your pet's health and well-being in the long run.